Do you have knee arthritis? Are you thinking twice about getting out of bed every day because of the stiffness and pain that your knees give you with each step that you take in the morning? Are you seriously worried that you'll need a knee replacement someday? Well, in today's video, you're going to learn all about knee arthritis. I'm talking about osteoarthritis. There's different kinds of arthritis, but osteoarthritis is the most common one that people deal with. We'll be talking about what causes knee arthritis, what symptoms to look for to make sure that you know that you've got it, and what treatments are available for knee arthritis problems. My name is Dr. David Minoff, and I'm a specialist physical therapist over at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and medications. Please subscribe to our channel so that you don't miss out on any of the helpful videos that we put out every single week. So let's tackle the big question. How does knee osteoarthritis happen? I've got a picture to show you to help me with my explanation. And just to give you the literal definitions for osteoarthritis, osteo means bone, arth means joint, and itis means swelling. So bone, joint, swelling of the knee if we're talking about knee osteoarthritis. But I'm going to use arthritis just for short because everybody refers to it as arthritis. If you're dealing with a psoriatic arthritis or a rheumatoid arthritis problem, then you're going to want to find another video to get more information on those issues. This one's going to be completely about osteoarthritis of the knee joint. So in my picture here, this is going to show you exactly how knee arthritis happens. Here I've got a picture of the front of the knee. The kneecap is in a black dot. You can't see it there. And I'm highlighting to you the purple and the orange parts. The purple is the knee cartilage on the end of the thigh bone. The orange is the meniscus on the top of the shin bone, and it cushions the thigh bone on the shin bone. It's the same deal over here. This is the side view of the knee joint. Here's the kneecap in the front, the thigh bone, the femur right here, and the shin bone, the tibia right here. The orange is the meniscus that sits on top of the tibia, and then the purple lining right there is the cartilage lining of the knee joint. So what's going on here? Oh, and the red right here is the muscle. This is the thigh muscles, the front of the thigh right here, the quadricep muscles, and then the back of the thigh, the hamstring muscles. And what I want to highlight is from the muscles, that's why I've written in red, there is too much pressure from the quad muscles and the hamstring muscles acting on the knee joint. When those two muscles together are too strong, they compress the knee joint and start to irritate or cause inflammation at that knee joint. This over time causes problems to the cartilage and the meniscus. That excessive compression is not tolerated well. You can take it for a little bit of time, for a day, maybe even a few weeks, but over the course of months, it begins to really irritate the cartilage and the meniscus, which is the type of cartilage, and damage it over time if this doesn't go away. I'm going to give you a little analogy to get the understanding of how arthritis really progresses over time. This one should make more sense to you. If you've ever done any sort of work with your hands and gotten blisters or calluses on your skin, it's the same concept that's happening inside your knee joint with the cartilage and meniscus. If you do too much work with your hands, let's say you're doing yard work or you're lifting weights with your hands, you will get a blister. And if you keep going, you'll pop that blister open and possibly bleed. It's the same thing with cartilage. If you put too much forces through it, just like you're putting forces through your skin, then it can become irritated. And if you keep going, it can tear or break down. But just like with calluses, if you put the right amount of forces through your skin and give it time to rest and recover, then you get thickened skin so that it's better prepared to take that yard work or that exercise that you're going to do again in the future without getting a blister or cutting your skin open and bleeding. The same is true in the cartilage in our knee joints and the meniscus. If you load it gradually over time, then it actually becomes more dense and better able to tolerate the forces you're putting on it. The problem is if you never give it a chance to rest. If those pressures on the knee joint are constantly too high, then the knee joint cartilage and meniscus does not get a chance to fully recover and allow itself to get thicker and more dense so that it can take the forces that you're putting on it well without becoming damaged or irritated over time. If this continues over the course of years, you can get a bone-on-bone situation where you wear a hole in the cartilage and now the bone under the cartilage is exposed, or even a situation where the bone itself begins to change and you get osteophytes, which are lumps on the bone, basically changes to structures in the bone that are visible on an x-ray, where the doctor might say, oh, that's not supposed to be there, you got a big bump on your bone here. The reason why that happens is because now the bone is getting too much forces on it, and it's also reacting to that force by thickening itself in the area so that it doesn't become even more damage in that spot. Now, that excessive force also compresses the meniscus, which is the cushion inside the knee joint between the thigh bone and the shin bone. And over time, if that pressure never goes away, then it compresses the meniscus down. And this is why on an x-ray, you might see decreased joint space, which is commonly measured in order to make a diagnosis for knee arthritis. So let's talk about the signs and symptoms of knee arthritis so that you can tell if you've got it or not. The number one sign is knee pain, of course. But especially in the mornings, when you first get up, when you first get out of bed, get your feet under you and begin to put weight through your legs, if your legs and if your knees feel stiff and they also hurt with that stiffness, that's a huge sign that you've got a knee arthritis problem developing or already very well developed. Another common sign is being 50 years of age or older. Although we've seen this in people that are younger than 50, people in their 40s sometimes do get knee arthritis. It's way more common to see it as we age. So people in their 50s, 60s, and beyond are the ones that are usually dealing with knee arthritis. This leads people to say that arthritis is an age-related condition, but I would turn that on its head and say that it's more of a time-related problem, because there are people who are in their 60s, 70s, and 80s that have no arthritis problems, and we can't say that it's because of their age. I really think that it's the amount of time spent with those excessive forces to their knee joint that equates to the development of arthritis. That's why some people can get it in their 40s, because they're very overdeveloped in their thigh muscles, so they're putting too much pressure to their knee joint, and they get it sooner, not because of their age, but because of the amount of pressure over the amount of time that they've maintained that pressure. It just tends to happen that the longer you go on through life, especially if you've got too much pressures through the knee joint because of the muscles, then you're more likely to develop knee arthritis problems. And the cool thing, just to give you a teaser about what I'll talk about at the end of the video, is this can be reversed as far as the pressures that go to the knee joint, which can alleviate the arthritis problems tremendously despite your age. Some other common signs and symptoms are stiffness in the thigh muscles, those same muscles that I mentioned. Of course, they're going to feel stiff because they're usually working too hard. Also, hip pain and back pain can occur with knee problems because people tend to begin to change the way that they move and walk, which affects the joints going up the chain of joints in the body. And another big symptom of knee arthritis is it hurts when you do too much. So people that have knee arthritis problems, if they are on their feet for too long, if they do too much exercise, if they do too much of something using their knees, it tends to make their knee problem worse. And it's because of that increased pressure through the knee joint. If you're moving on an already overpressurized knee joint, it's just a matter of time before it further irritates it. Even though it might feel good and might be necessary to move it some, overdoing it tends to make it more irritated. Often when people go to the doctor for knee pain and they get the diagnosis of knee arthritis, they're told that they also have a meniscus tear or some meniscus injury, and it's because of the same root problems that overpressurized knee joint is compressing on the meniscus. Let's talk about the treatment options that are commonly given for knee arthritis. Number one is resting it. Doctors often will say, get off your feet, stop being so active, stop this exercise or that exercise, quit running, quit lifting weights. They'll say things like that because it really does reduce the inflammation in the short term so that the knee joint can be a little happier, and simple movements like getting up out of bed tend to become a bit easier. But it is short-sighted in that it doesn't give the individual a chance to work on the muscle imbalances that are causing too much pressure at the knee joint. But in the short term, it may help them reduce taking medications and seeing the doctor for more things. Over-the-counter pain medications are often used. There's tons of commercials out there for medications specifically for arthritis, and those can offer short-term pain relief as well. When it gets really bad, doctors often will also offer injections for knee pain. They'll give a cortisone injection for knee arthritis, and that's designed to reduce the inflammation in the knee joint as well as relieve the pain. But this, of course, is also short term, and it doesn't fix the pressure problem inside of the knee joint. There's a new field of medicine that's been developing over the years called regenerative medicine, which is focused on regenerating cartilage cells that have been lost or severely damaged. And they do this through the use of stem cells and other treatments like platelet-rich plasma injections. And although this is really cool and I'm excited to see where this field is going to go, it still does not solve the problem of having too much pressure to the knee joints. I have seen in treatment people that have had platelet-rich plasma injections and stem cells put into their knee joints, and some have had an improvement, honestly, and some have had no change. I haven't seen anybody that got worse, though. I've yet to find that, but I still see that they have the muscle imbalances, the excessive pressure in the knee joint, and I suspect that if they spend all that money, because this isn't covered by insurance, if they spend all that money on their regenerative medicine therapies, I would want to make sure that it lasts them a long time. So fixing the underlying root problems is a big, big concern to make sure that you get long-lasting improvement for your knee arthritis problem. And of course, the most invasive treatment is going to be a surgery. There's different types of surgeries done for knee arthritis. The first type is an arthroscopic procedure where they make little holes around the knee joint and they go in with a camera and some tool to do different things. They might be fixing the meniscus, they might be debriding the knee joint, which means they're cleaning it out. And a more extreme operation for the knee is replacing the knee, which is called an arthroplasty, or a knee replacement as we commonly know it. A more rare surgery is a cartilage graft, and this is where we'll take a piece of cartilage either from somewhere else in your body or from a cadaver, somebody who's deceased, and they'll put it into your knee in order to fill in a hole of cartilage. But as a specialist physical therapist, I see people with knee arthritis problems all the time, and we help them get tremendously better naturally without surgeries, injections, or pain medications. And although arthritis can't be cured, in other words, if we help somebody with a knee arthritis problem and they come to us with an x-ray showing us their loss of knee joint space and their issues that have been diagnosed through x-ray for their knee arthritis problem, and we go through treatment, and then at the end of treatment, their x-rays are probably going to look about the same as the beginning, but the difference is in their mobility, their range of motion, the feeling that they have in their knee, and their ability to do things in life. Most of the time, getting up out of the morning and being less stiff happens. They can get up easier. They're not thinking twice about getting up in the morning. And they're getting back to doing exercises, even things like squatting with weights, things like jogging, going up and down stairs are possible without pain in somebody who's been diagnosed with knee arthritis. If you're looking for exercises and natural ways to begin to improve your knee arthritis problem, then I want you to check out the videos that we've linked in the description below that offer free exercises to help your knee arthritis problem. We've also got a special 28-day knee health and wellness boost program that we offer. The link is in the description below. It's a comprehensive 28-day program. It's completely online and on demand that you can begin to work through to improve your knee joint health so you can get back to being mobile, active, and healthy again in your knees. If you thought this video was helpful for you, please give us a like, and don't forget to subscribe and turn on your notifications so that you can get notified whenever we release helpful new content. Have a wonderful day. Bye-bye.